Imagine this. You're in the OET exam writing your letter, but then it hits you. Is this a known case or an unknown case? Well, this exact confusion arose in the minds of some of the candidates who took up the exam on the most recent OET exam, that is 8th Feb 2025. Now let's figure out what caused this confusion and how such situations can be tackled. Before getting into the case note and the writing task, we need to understand what do you mean by this known case and unknown case and how can we differentiate between them. So now let me tell you what a known case and what an unknown case is. Known case basically means that the reader, that is the person to whom you are writing the letter, already has got some prior information regarding the patient. That is, the patient is not new to the reader. Now, if it is an unknown case, the patient is totally new to the reader. We are introducing the patient to the reader. Now, how can we identify this from the case note and the writing task, whether it is a known case or an unknown case? I'll show you some instances. Now, first, that is, if the reader, that is the person to whom you are writing the letter, is a family doctor, then of course you have to conclude it as a known case. That is, the family doctor will be having the basic details regarding the patient, like the patient's medical history and social background, and of course it is a known case. Now, another instance is, if you see the presence of this possessive noun, that is patients, this apostrophe S is noted before the reader's designation, then you should understand that it is a known case. For instance, if you're asked to write letter to the patient's GP, or else if you're asked to write letter to the patient's dentist, in all these situations you have to understand that it is a known case. That is, the presence of this possessive noun apostrophe S just before the reader's designation indicates that it is a known case. But one more thing that you have to be careful is that this possessive noun patients should be appearing just before the reader's designation. Sometimes it can happen that you might be asked to write a letter to a GP in the patient's locality. Now, there the patients or the possessive noun appears before the word locality. Patients, locality. So here the reader's designation is not coming next to this possessive noun. So this cannot be considered as a known case. Okay, I hope that's clear. Now, a third scenario is where the reader's and the patient's addresses are identical. When I say identical, it has to be exactly same, meaning to say word to word they should match. Now, how can this happen? How can a patient's address and reader's address be exactly the same? In situations where the patient is a resident of a nursing home, or if the patient is a resident of a rehab center, assume such cases. Now, if a patient got treated from our facility and you are discharging the patient back to the nursing home or the rehab center, and you will be asked to write letter to the manager of that nursing home or the director of that rehab center. So the patient's address will be same as that of the nursing home, and even the nursing home manager's address will be same as that of the nursing home, which means that the addresses match exactly the same, word to word. In such case also, it should be considered as a known case. So I hope now you got a clarity on what a known case and unknown case is and how to differentiate between them. Now, let's try to understand what is the importance of differentiating between a known case and unknown case. How does this reflect in our letter writing? Now that we have understood what a known case and unknown case is and how to identify whether it is known case or unknown case, we also need to understand actually what is the significance of differentiating between a known case and unknown case. How does it actually affect our letter? So we know that our letter is assessed based on assessment criteria. We have 6 of them: purpose, content, conciseness and clarity, organization and layout, genre and style, and language. Now, what is this assessment criterion, conciseness and clarity say? In conciseness and clarity, it focuses on two main points. That is, you should not be including unnecessary information in the letter, and the information must be clearly summarized. Now, what do you mean by unnecessary information? How can information be unnecessary? You might feel that all the information given in the case note are necessary. Of course, they are necessary with respect to the patient, but with respect to the reader, it might not be the same. So, depending on the reader, only if a specific information or a detail is necessary for the reader, you should be including them into the letter. Now, what do you mean by necessary information to the reader? If it is a detail or if it is a data which the reader doesn't know, of course you have to convey it to the reader. Or if it is a detail which might be actually helping the reader in taking care or managing your patient, of course you should be conveying it to the reader. But at the same time, if it is an information which the reader already knows, then you should not be including it in the letter, because we know that the healthcare professionals' time is valuable, and we should not be wasting their time with unwanted or unnecessary details which either they might be knowing already or which are of no use to them. So, unnecessary information or irrelevant information means which the reader already knows. Now, talking about this known case and unknown case. If it is a known case, we have to understand that the medical history and the social background the medical history and the social background will of course be known to the reader. Yes, so because this patient is not a new case to the reader, so the reader will already be having the medical history and social background of the patient. So once you understand that the given case note or the given situation is a known case, you should be careful not to include the details from the medical history or the social background into your letter. So I hope that by now you've understood what a known case is, what an unknown case is, how to differentiate between them, and what is the necessity or what is the importance of differentiating between them. Now let's dive into the case note. You can see the case note here. This is the first page which contains the social background, medical history and the recent happenings, and you can see the continuation of the case note, and you can also see the writing task. Now let's look at the writing task. Who is the reader here? You're asked to write letter to the head of the community discharge team. Head of the community discharge team. So when you start reading the case note and the writing task, the first thing that you need to identify is who is the reader of the letter. So here it is the head of the community discharge team. Now we need to identify whether it is a known case or unknown case. So we already have our checkpoints to identify whether it is a known case or unknown case. The first one was family doctor. Of course, this is not a family doctor. Then second, we have to see whether there is a presence of that possessive noun, patients. We cannot see any such thing here. Then the third situation is whether the address of the reader exactly matches with that of the patient. Now let's see that. Of course, it's not a family doctor, and you cannot see that patients, that possessive noun is also not seen. Now let's compare the addresses of the reader and the patient. So the address of the reader is Henry Street, 254, Queensland. Now let's look what the patient's address is. The patient address says that Suite 548, 4th floor, Henry Street, Queensland. Now, this is the area that prompted some of the students to think that it might be a known case because of the similarity in some parts of the address. The street name and the area are same. You can see Henry Street in the patient's address and Queensland also in the patient's address. But what did we just discuss now? The similarities in the addresses, that the address of the patient and the address of the reader should be exactly identical, word to word. Only then we can consider it as a known case. But here they are not exactly the same. There are of course a few differences in the addresses of the reader and the patient. And for that reason we conclude that this is an unknown case. I hope you understood this. Now, let me conclude by saying that OET writing is not merely about transforming the case note into grammatically right sentences. What I mean to say is that even if you're somebody with good language skill, that is just not enough. You have to clearly understand what the writing task is. You have to understand who the reader is and what is the purpose of writing the letter. This clearly defines how your letter looks like. Because it is based on the reader and the purpose, you select the data and you organize the data. Then you have to transform the case note into sentences. So I hope you found this video helpful. We'll be back with more such videos. Stay tuned.
Medcity International Academy. Trusted hands forever.